I'm Deb Kimmett, and this is the news brief for February 21st, 2022. There are actually two parts to this news brief. This part one, overviews a framework that we can adapt for our massage therapy practices to help us move forward. Part two covers the rest of the news since the last news brief in January. And we'll begin in our usual way, which is a shout out goes to the Massage Health Practitioners and COVID-19 Facebook group. They provide accurate, evidence-informed info, and I want to credit them for a job well done during the pandemic. They're just one of many resources that I use to gain information for these news briefs. You'll notice at the bottom of the slides, I have an abbreviated source. I mainly want you to see the author and the date because I try to bring in the most current research. The full citation is in the show notes, which is the companion PDF file. And before we get into the topic for today, remember that science changes, so what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. States and cities appear to be moving forward, getting rid of all or some of their indoor mask mandates over the last month or so, even in the strictest areas like California and New York. And while the CDC is saying right now that it's too soon to do this, it appears that the CDC will update its guidance anytime now. But is it really wise to do that? And what markers are they using to determine these policies? And what happens when the next wave arrives? And more importantly, how do we as the massage therapy profession move forward? Jetelina, who runs the Your Local Epidemiologist blog, had some insights into that, and I think provides some good guidance going forward. She and some colleagues put together some metrics concerning how we can cope with the continuing presence of SARS-CoV-2 and the ups and downs of the variants that will come and go. Specifically, she discusses the metrics that pertain to when we can let go of some of the safety precautions that we're now doing and when they need to be reinstituted. She contends that a system needs to be put in place that helps drive our behaviors because simply getting rid of mask mandates or keeping them isn't really the way to go. She and her colleagues used the number of cases and test positivity rates to anchor the framework, not hospitalizations and deaths. Her reasoning is that by the time decisions are made using the hospitalization model, the transmission of the virus is already uncontrollable, and that the number of cases is tied more directly to transmission. Also, case numbers and positivity rates are provided on a regular basis by the CDC, so people can go look up the numbers for their local county. While this is only a few people's opinion, it seems to make a lot of sense. For me, her benchmarks and activities are pretty close to how I've run my practice. And I'm sure other experts will come up with their own ideas, but it makes a lot of sense to ride the waves as they ebb and flow. Jetelina and company put together a handy dandy chart that I want to go through. The link to it is in the PDF notes. While they say that the purpose is to leverage public health tools, the last sentence really says it all to me, that more importantly, it empowers individuals to reduce transmission in the event of future waves. So it gives us a tool that we can apply in our practice, and I'll go through that after we've reviewed the basic chart. First of all, it talks about vaccination rates in the top box. And if the vaccination rates are greater than or equal to 85% community-wide, you don't have to follow the precautions at all until there's a variant of concern or of high consequence. If it's less than 85%, then you use the rest of the chart. The next part of the chart determines which category that you're in. And what she goes by is county level cases per 100,000 in 7 days, or the test positivity rate. And if you look at the note at the very bottom of the chart, it says that if the two indicators suggest different transmission levels, the higher level is selected. Here's an example. On the day I recorded this, I looked at my county level cases, and what that said was almost 46 cases per 100,000 was the 7-day average. And so that puts us in the yellow, in the upper part of the yellow. But when I looked at the test positivity rates, the test positivity rate was over 15%, which puts us in the red. So in this case, I would follow what the red category says. So let's look at what else this note says. Currently, cases and test positivity rates are an adequate measure for surveillance. However, this may change with the increase in antigen testing. When cases and the test positivity rate significantly diverge, we will need to integrate another metric for behavior, like wastewater surveillance. Well, my county doesn't have any stats on that yet, so I am still going to just follow those two metrics of the test positivity rate as well as the case level rate. And so for me, what I would follow is all the information that's in the red. In the next row, that begins what it is that we need to do in terms of our behaviors. And so, for example, it talks about masking. And there's a couple of stars there. So what it tells us in the footnotes is that these must be a well-fitting mask, like an N95, a KN95, or a KF94. And so when you're masking indoors in public, you definitely want to mask when you're in the red or the orange, and you don't need to mask when you're in the yellow or the blue. With regards to antigen testing, if you are symptomatic, so you take an antigen test, then what it's saying here is that if you're positive, if that test shows up positive in the red or the orange, then trust that result. If it's negative, take another test in 24 hours to see what happens. When you're in the yellow, no matter whether you're positive or negative, you want to retest in 24 hours. And if you're in the blue, if it's negative, trust that result. But if you're positive, you want to retest the next day. And then the next row talks about what happens if you did test positive and what you do with your isolation. And in all cases, it's saying here that you test to exit. And remember what the CDC says is that you isolate for 5 days and then you mask for another 5 days. Basically, that's the general idea here. But what they're saying here is that in the notes, you do not leave isolation before receiving a negative rapid test. And if not possible due to employment, leave isolation after 5 days and mask with an N95, just basically what I said there. So what happens if you're exposed? In the notes below, it talks about that and says, a close contact is someone who is less than 6 feet away from an infected person, for a cumulative total of 15 minutes or more over a 24-hour period. So for example, 3 individual 5-minute exposures for a total of 15 minutes. People who are exposed to someone with COVID-19 after they have completed at least 5 days of isolation are not considered close contacts. And so in the test here for all the categories, except one, it says if you're not boosted, yes, you want to quarantine for 5 days. And if you are boosted, you don't have to quarantine, but test 5 days after exposure. And then with the blue level is that you don't need to quarantine, but test 5 days after exposure. Then just in general, what the community needs to do is to improve ventilation in spaces, improve equitable access to antigen tests, ramp up supplies of antivirals, continue vaccination campaigns locally and globally, and strengthen surveillance research, long COVID-19 treatments, and fight disinformation. Basically, it's just doing all the things that we need to do. And finally, the last row, I think, is where the money is, because it gives us examples of activities that we can do if we're not sick. And it just gives you an idea of some of the things that are safe and not safe as part of working through all these waves. So for example, in the red, it's the most restrictive in terms of activity levels go. And then as you move through the categories, then eventually we get down to the blue level where when the case levels are low and the positivity rates are low, then there aren't any limitations. And so the idea behind the chart is to help us be able to ride these waves as variants come and go and as our case numbers go up and down, rather than trying to announce certain things at certain times like what they're trying to do now. The general idea here is we can monitor this ourselves and figure out what works best for us. So what is the massage therapist takeaway? We can apply or remove restrictions on our practices based on clear-cut metrics. We can clearly communicate those metrics and restrictions with our clients, so it doesn't appear that we're random in how we apply them. For example, we can tell our clients this: when case numbers and test positivity rates hit a certain level, then I'll add or subtract these restrictions. If they're not in the same category, I'll go to the highest one. In my own practice, when the case rates were going down, I waited a week or two after we hit a particular benchmark because I wanted to make sure that the numbers are stabilized before I remove a restriction. If the numbers are going up, I'll warn clients before the numbers hit a benchmark and will institute restrictions beforehand. You can set your own restrictions based on your comfort level, but that's what I'm choosing to do. Due to the nature of our practices, because we're in close contact for an extended period of time, our precautions might be a bit different. Let's walk through some of that. Here are some suggestions. For indoor public crowds like concerts, sporting events, or conventions, in the red and the orange, it says avoid indoor crowds who are not 100% masked and vaccination status is unknown. In these two categories, you might treat the vaccinated only, or tell them that they can't come in for an appointment within 10 days of such an event. In my state, I can't do the first one, but I can do the second. And to make it easier to count out the time, I say 2 weeks. But the 10 days will get you past the window of potential infection. Remember, last month I talked about 31% of people can be infectious past that 5-day isolation period per the CDC guidelines. And when you hit the yellow, you could open it up to the unvaccinated or remove the 10-day restriction. Or wait until the blue to do that if you'd feel more comfortable. This chart also gives us a clue around masking. The red, orange, and yellow say to avoid or okay with masking. So I suggest keeping those masks on until you hit the blue. When in the blue, that's when some decision-making comes into play. Maybe you and your clients stop masking, or you keep them on, or you mask and your clients don't. Maybe you use a KF94 instead of an N95. Those decisions will be based on your decision-making around risk, vulnerabilities of you, your family, and your clients, and other factors. And the chart also gives restrictions around travel. In the red, clients can come in 10 days or 2 weeks after getting on a plane. Set your own boundaries for the orange, and you may do the same for yellow. But you may want to go with no restriction on flying in yellow because client and therapist are both still masked, and no wait in blue. For restaurants and bars, the restrictions are similar to travel. In the red, clients can come in 10 days or 2 weeks after dining out. Set your own boundaries for the orange, and when in yellow, no restrictions because client and therapist are still both masked, and no wait in the blue. So generally, you can see how this chart can be helpful when determining your policies going forward when those COVID waves come and go. The links to the chart and the massage therapist takeaway are in the show notes. Check out the part 2 video for the rest of today's news brief. And again, please remember that science changes, so what we know today may not be what we know tomorrow. It's always changing, so take care, stay safe, and be healthy.